Welcome to the Pharmacy Leaders Podcast with your host, Tony Guerra. The Pharmacy Leaders Podcast is a member of the Pharmacy Podcast Network, with interviews and advice on building your professional network, brand, and a purposeful second income from students, residents, and innovative professionals.
Hey, welcome to the Pharmacy Leaders Podcast. Today I have my P4 student, Kelsey Zenti, who's from the University of Iowa. It felt like she just got here, and here it is 5 weeks later. Those of you that haven't done APPEs yet, that's exactly how it's going to feel. It just goes by so quickly. So, Kelsey, welcome to the Pharmacy Leaders Podcast.
Thanks for having me. It really just feels like that first Monday I was walking into the Ankeny campus, a whole new world, and here I am on my last day.
So cool. Well, what I thought we would do is, since you were in a teaching rotation, we would kind of give a little advice to the P3s. P3s are kind of stuck in a position where early in fall, or maybe even later in fall, they have to make decisions about APPEs. Now that you've finished your second rotation, can you tell us a little bit about how you put your APPEs together?
Sure. So I know as a P3, it's so overwhelming to try to somehow come down to 8 choices. But really, when I went into my preferences, I wanted to get as many experiences as diverse as possible, because although I knew I was interested in ambulatory care, I wanted to see all different practice sites because I didn't really want to pigeonhole myself just to go down that path. You know, I wanted acute care settings, which you have to have. I have a few different ambulatory care. And then I use a teaching rotation because although not all pharmacists are, formally in academia, they're going to be teaching their patients, their students. There's always going to be opportunities for them to pass their knowledge on to other people. So I just really wanted to pull from many different areas of pharmacy and just try to make myself as well-rounded as possible.
Outpatient chronic disease state management, that's something that you've talked about being interested in. You did take a break here with a non-patient care rotation, but how did you get interested in outpatient chronic disease state management?
So I worked in the outpatient pharmacy at the VA, and that's really where I was exposed to chronic disease state management and being able to really form that relationship with the patient, as well as reducing the burden on physicians, specifically primary care physicians, which are already kind of at a minimum. And so it's really great that there's pharmacist managed clinics. You get to set up the appointment with the patient. You have time to sit and talk with them, learn their story, learn about their disease states, and really form a relationship with them and see them evolve personally, health-wise, and I really think we can have a positive impact on their health outcomes in the end.
So tell me a little bit about being able to stay with the patient a little bit longer. I worked in retail where I would say, lane 1, do you have any questions about your medicine? Lane 2, do you have any questions about your medicine? Go right over to the pickup window. Do you have any questions about your medicine? Where the law just required that I make an offer to counsel, but instead you get a scheduled appointment time. How is that different?
So I also worked in a retail setting, and so I saw what you're talking about where, the pharmacist is so busy, even the interns are so busy. If the patient doesn't express any concerns or questions, really it's only going to be a few second interaction. And so when a pharmacist is working in chronic disease state management, they really get to sit down and truly try to understand the patient, listen to them, address their concerns from the beginning, and really see them grow, over an extended period of time, which to me, that's really meaningful. And that's where I really feel like I will feel fulfilled as a pharmacist to form the relationship with those patients and, manage them over the period of time that, they need management and hopefully, help them get in control of their health care.
Well, everybody has, their own skill set. Whether it's a job interview or a residency interview, you're going to be asked to talk about your strengths and weaknesses. And as I've seen you here, I've noticed that there are 3 big ones that I've really noticed. And the first one is you're well organized. How does your organization kind of fit into what you want to do? And you just seem very happy to organize things. But how does organization help the patient?
Right. So I'm the type of person that, I carry around my planner. I write everything in there. I have a calendar on my phone. I have stuff in there. I have a sticky note on my computer. Yeah. So some might think that's overkill, but to me, being organized is going to help me be successful. And so I can kind of carry over that organization in my own life to my patient's life so that we can talk about, certain disease states step by step, and then really translate that to the patient as a whole. Make sure we're addressing all of their needs, whether it be through medications or non-drug therapy. But really, I think my organization will help me kind of differentiate between patients, make sure the care is patient-centered, and then also with documenting that in the health record for other healthcare providers so that this patient can continue to get the best care possible.
When you're in retail or when you're in community, a lot of times a patient will come up and you just want to give the answer, but I found that you really took some time when we had some breakouts with the students in terms of being able to go a little more one-on-one with small groups. Tell me a little bit about how you work as a good listener. I tend to be a talker, which is great that I'm engaged with people really quickly, but I also may talk over them. But how do you become a good listener, I guess?
So ever since I can remember, listening has been my thing. I remember being at family events, and I would always be around the adults, listening to what they have to say. And my parents would be like, go play with the kids, go outside. And, I was just always so thirsty for knowledge, and my brain was just a sponge that I just wanted to listen. I didn't even care if anyone talked to me. I was just kind of absorbing all of that information around me. And so I think I can really use that as a strength when meeting with patients in the future, because I will listen to everything they have to say, take all of their thoughts into consideration to make the most appropriate recommendation in the long run. And I think being able to listen, sometimes patients don't feel listened to. And I think that will help me kind of build rapport with my patients and have them respect me as a healthcare professional.
Ultimately, patients have healthcare problems. They need solutions for them. But when somebody says, in an interview, well, I'm a problem solver, or on their CV, how do you illustrate that, or how do you give advice to somebody who's thinking about interviewing for residency? How do you show your problem-solving skills and make that more concrete?
I think the biggest way is to really always try to do the best for the patient. So if they express a concern to you, don't just say, okay, well, whatever, that doesn't matter. Really think thoughtfully about what they're saying and how we can address that, how we can solve that problem. And, we're not going to know everything as pharmacists, but it's important to know where to go to find the answer. And so I think that's another one of my big strengths is I may not have the answer right now, but I'm going to get in contact with someone who does, but I'm going to solve this problem. I'm going to create a solution. And again, we're a team. Me and the patient, we're in this together, whether they think that or not. But, I'm always that person in their corner, fighting for what's right for the patient.
My wife likes to say that every once in a while I'm hearing but not listening to her. But it sounds like you've got the listening part down, and maybe I could actually get some advice from you.
I like to think so, but...
Yeah. Okay, well... New residencies, if you're going to do a residency, if you're going to do something postgraduate, they want to know that you've at least embraced the research project. Have you had a lot of research experience? Have you had any research experience at Iowa?
So, I was really fortunate as we were required to do a research project in our curriculum. And I know not all pharmacy schools have that component. So it was really nice that this was presented to us and a requirement. So we had different faculty members and preceptors come in and explain their research interests. And then we were able to almost preference our choices based on what their interests were and help us align that with our interests. And so I chose a project that was ambulatory care based. So the title of the project was Evaluation of Pharmacy Management of Warfarin in Post-Orthopedic Patients, which is a mouthful. Yeah. But basically, this was a chart review. We collected data, put everything together, analyzed the statistics, and then we wrote a manuscript and created a poster, which was a requirement for the class itself. But my group really was pleased with the results that we found. So we wanted to get this information out to people beyond the College of Pharmacy. So we took it a step further. We prepared our manuscript for submission to AJHP, which we're still in the process of finalizing that up. And then we also presented our poster at the IPA annual meeting. And so that was a really great experience to not only see other projects that are in the pharmacy world right now, but also to present our information that we found through our professional discovery projects.
Well, I know a number of students are always concerned about that. Am I going to have enough under research on my CV? Am I going to have enough teaching on my CV? You sound like you've kind of taken on some roles where you did what you were required to do. You know, there's certain required APPEs, but you've also kind of addressed something which is it's the toughest question, I think, is to always get, what are your strengths? It's tough to talk about yourself, but then what are your weaknesses? And I think what they're really looking for is how do you address when you have weaknesses? So can you talk a little bit about how you've maybe overcome difficult situations where you find yourself, wanting to work on some of your abilities?
Yeah. So, through pharmacy school, we've had group presentations or other sorts of projects where we have to get up in front of a group and present. And really, we haven't had a ton of experience to that. There's been a little bit, but I really saw that as an opportunity for me to grow. I wasn't super comfortable in front of a crowd. I hadn't had a lot of experience with it, like I said. And so that's also another reason why I preference this DMAC rotation, because there was a big teaching component. And so, I got experience preparing lecture materials and presenting to students in a classroom setting as a large group, as well as a small, more individualized tutoring session. And so since I didn't have this really prior experience, I kind of faced my weakness head on. And so I really believe that I improved my public speaking skills, my teaching style was somewhat developed. I think you provided me with a lot of great feedback to, bring on to the rest of my rotations when I'm giving case presentations and that sort of thing. But really, I just wanted to put myself outside of my comfort zone. And that definitely happened. And that's where I think the most growth occurs.
Yeah. So as you get through, you seem kind of calm, cool, and collected. Maybe you're just putting on the face. I don't know. But every time you come in here, you seem like the world is just fine and things are going well. It sounds like you've got the secret to managing stress. But some students out there are in their second APPE and they're really struggling. Maybe they've planned a wedding. Maybe they're having children. Maybe they're working another job, maybe two jobs. How do you manage stress?
So, everyone feels stress. A certain amount of stress is good. It motivates you to get things accomplished. But at times, especially during this APPE year, the stress becomes overwhelming. And so like everyone else, I kind of have that moment of panic where I can't do this, I can't handle this, but it only lasts for a few seconds because having that mindset is not going to make you successful in the long run. And so once I feel kind of that emotion overtaking me, I kind of flip the script and I say, all right, let's bring in my organizational skills and my problem solving skills.
Yeah.
Really, I draw on those strengths because that's what's going to help me manage the stress. And so I really kind of make a game plan going forward. And I say, I need to do this and this. These are my most recent deadlines. These are longitudinal. When am I going to work on this? And really, it's all about making a game plan. And then I think once, maybe the work isn't done, but as long as you have that plan in place, that stress will slowly start to dissipate because you feel more in control of the situation and, you're giving yourself a path to success.
Yeah. Something that really impressed me about you is that I said, everyone has to do an interview and then be interviewed for the end. But you said, I'm going to interview the residency director at the Iowa City VA. And I guess I was just really impressed by that because I would have not had that courage. I would have said, I'm going to interview a resident over there. And I don't know if I would have gone right to the residency director. Where did that courage come from? And obviously in talking to her, we've already, published that episode. You got to know her, very, very accommodating, a very nice person. And there was just a lot of information that you got in that conversation. But where does that courage come from?
It's funny you should say that. Well, like I said, I did work at the VA, and so I had met her briefly, so there was, somewhat of a connection. But like you said, it would have been easier to interview a resident. But, I was like, let's just go for it. Let's reach out to Dr. Nancy Waterbury. And, she was so kind and so willing to accommodate, the podcast. She set up a room for us to meet in and really provided with me and the rest of the listeners with so much valuable information, because we don't always get to see that side of things. I mean, how often does a residency director, talk to a P4 student and give them kind of all the insight as to what they're looking for and what you should be doing at mid-year and that sort of thing. So really, I just looked at it as an opportunity to really present myself to Dr. Nancy Waterbury and kind of take away everything that she has to give. And so that's kind of how that idea popped into my mind. And I'm really passionate about the VA and maybe working there in the future. So I just thought it was the perfect opportunity.
Yeah, I just kudos to you is what I have to say. Kudos to you. So, I've asked you a lot of questions. Is there anything you want to say before we close out? This is the last couple minutes of your rotation here, and you're on to your third block. Anything last words that you have?
I just want to give a few words to my fellow P4 students that what I've learned over these 2 rotations is don't be afraid to ask for help and don't be afraid to ask questions. Your preceptors are there to help you learn. Everyone else around you is here to help you learn and help you apply that information that you learned in the classroom to real world, real patient settings. And so sometimes, it can be intimidating in a hospital of 700 patients or whatever situation you're in, but don't ever be afraid to ask a question, because chances are someone else has asked that question.
Okay. Well, Kelsey Zenti, thank you again for helping our students. Thank you again for your hard work. And thanks for being on the Pharmacy Leaders Podcast.
Thanks for having me.
Thank you for listening to the Pharmacy Leaders Podcast with your host, Tony Guerra. Be sure to share the show with the hashtag #PharmacyLeaders. Support for this episode comes from the audiobook Memorizing Pharmacology, a relaxed approach. With over 9,000 sales in the United States, United Kingdom, and Australia, it's the go-to resource to ease the pharmacology challenge. Available on Audible, iTunes, and Amazon.com, in print, ebook, and audiobook.